Hello everyone, my name is Zina Abdulkadir. Today I'll be recording my Information 675 research proposal project on narcotic abuse surveillance and literature review for Mercer University, Information 675 for fall 2018. So for my executive summary, the purpose of this project is to better understand how health information technology is currently used to fight the current opioid crisis in the United States through the use of narcotics surveillance application system. The application system that I'll be using for my project is the South Carolina Prescription Monitoring Program, also referred to as SCRIPT, the South Carolina Reporting and Identification Prescription Tracking System for this study. So healthcare providers do play a huge role in minimizing and preventing the misuse of narcotic substances through computerized supervision to end the overprescribing of controlled medications. Introduction and background. So according to the Center for Disease Control and Prevention, prescription opioids are commonly prescribed by board-certified physicians to manage moderate to severe pain, such as Percocet, morphine, and Oxycontin. As this issue continues to affect the American population, leading organizations and healthcare providers and information technologists have been basically working together continuously to provide the necessary tools and resources to regulate and manage this problem. Stakeholders in this research study will include a variety of healthcare providers within the medical profession with licensures such as medical doctors, advanced registered nurse practitioners, and physician assistants. So my research problem and issue is that opioid abuse is an epidemic that is affecting many Americans and increasing the death rate by thousands. So the Center for Disease Control and Prevention is working extensively in improving data quality and tracking trends by supporting healthcare providers and health systems. Both the National Institute of Drug Administration and the Center for Disease Control and Prevention are relying heavily on health information technology to identify, supervise, and provide the necessary help in treating patients who suffer with the opioid dependency. And then the SCRIPT database is basically a 24/7 website utilized by healthcare professionals in reporting information regarding the prescriptions and refills of controlled substances from healthcare providers and pharmacies associated with the patients. So the risk identification. So for this project, the risk identification is that I currently, me being the primary researcher, do not live in South Carolina. However, in order to manage this risk, I have a classmate who is currently an advanced practicing practitioner nurse who has the ability and has the resources and currently works at a facility that work with other physicians and physician assistants who currently do use the system. So for my literature review, I did 5 resources. The first one is the Intelligent Clinical Decision Support to Improve Safe Opioid Management of Chronic Non-Cancer Pain in Primary Care. So this research study examines the implementation of clinical decision support systems among electronic health record systems with patients with chronic pain in relation with healthcare providers' compliance with the standard guidelines of the system. The literature review number 2 that I did was are prescription opioids driving the opioid crisis. So basically this literature review analyzes factual information regarding the opioid crisis and on prescription medication, and if opioid overdose is however it is fast and rising and is causing deaths, how is the battle that many healthcare organizations and facilities currently are fighting to minimize these effects. The third one I did was chronic pain and opioid misuse, a review of reviews. So this basically basically looks over about 2,000 research articles and narrows down the search to about 18 systemic reviews. And then within these reviews, it helps identify research articles related to the misuse of opioid substances with chronic pain, and gathers further information on the epidemiology and clinical management. The fourth one that I did was the article was prescription opioid abuse, pain, and addiction, clinical use and implication. And this basically reviews the interchange between opioid addiction and overall pain levels. And the last one that I did was called the Prescription Opioid Abuse and Literature Review of the Clinical and Economic Burden in the United States. This basically discusses, this study basically is like a comprehensive literature search through medical data websites, and basically combines strategies and concepts related to prescription opioids, disorders, burden, illness, economics, and also the quality of life. For my Gantt chart, I would pull it up and bring it on another screen. So I basically did it in 3 phases. Phase 1, phase 2 is phase 3, and I just talked